Hello, everybody. Welcome to Rekindle XM. Today we have a very special guest with us, Dr. Sean Thompson, who's going to help us dive into a body's stress response, the chemical, physical, and mental impacts thereof. Dr. Sean has been in practice since 1996 in Parker, Colorado, and he specializes in musculoskeletal pain and stress management. Welcome, Dr. Sean.
Well, hi. Thanks for having me, you guys. I appreciate it.
Would you like to tell our audience a little bit more about your expertise and what you're passionate about helping people with?
My main focus in my practice is, of course, musculoskeletal injuries, but that comes with a whole other set of issues that I also work with. I'm also a Buddhist minister. I was ordained in 2006, and I've been teaching meditation and stress reduction and management in a kind of a Buddhist perspective since then. I also teach at a psychiatric hospital as well as a couple other rehabilitation places where I go through and try to get people a chance to use their minds to work with their bodies and their chemistry and then interconnect all of those things so that we can get a more holistic uh, kind of like toolbox of things to do for stress and injury and trauma and things like that. That's kind of my main thing over the past few years. It's really developed into a more using things like acupuncture and dry needling and chiropractic and meditation and things like that. We've been able to kind of like customize things for an individual, which I think is very important. That's what I've been working on.
So you're passionate about providing an individual with all the necessary tools and equipment for their bodies to literally heal itself.
Yes, and actually, because everybody is very unique, like there's no one answer fits everybody. And so we have to kind of like tailor that because people have a different chemistry, I guess you could say profile, the things that they're taking in, the things that their bodies are doing. There's an entire also physical different profile, like how their bodies are working, how resilient their physical body is, and then also their mental aspect or spiritual aspect, even you could go that deep and talk about things like how they process injury and anger and suffering and things like that. Does it store up in their body? Because, people often say, like, I hold all my stress in my shoulders. Well, what does that really mean? And where can we go with that? Or some people get digestive issues because of it, which could be largely related to some chemical issues too. So there's a lot that we need to kind of like tweak and organize for one individual person at a time. It gets complex.
Yeah.
It's nothing that we can just here's your prescription. Everybody does the same. We have to like take time and kind of come up with your own battle plan and your own way of dealing with and adapting and coping with all of these different stresses that come in our lives.
We can definitely relate to the acid part of the stomach issues with stress because Michelle and I both have that.
I hear you, man.
Omeprazole is a very familiar name with us.
Ah, yeah. I have a stuff that's some enzymes that I take. Actually, if I eat something like, and this happens after you become about 35, your enzymes for digestion drop off at a small percentage every year after that. And I've gotten to the point where I can't have like red meat or pork or anything barbecue, and no way I can have spaghetti after like 7 or 8 p.m. Otherwise, it'll wake me up about 2 in the morning. So I have to have enzymes that I can take to help me with it. And that's what I usually do. Yeah. So a lot of those things, man. Ooh, yeah.
Well, it's interesting because, like Brian said, we both have had those issues, and I started having those issues during really, really high stress. But what's interesting is not everybody has that. Going back to your point about how people have these unique symptoms, and of course, coming from a public health background, we want to look at all these statistics and, oh, well, this is the norm. This is, how we treat. But I think I'm curious in your opinion on Western medicine, and we kind of treat to the curve. So this is the normal response that everybody has. So here's the medications we put you on. But it sounds like from your practice, like you recognize that individuality and that need to treat the whole person rather than just, oh, this is the normal treatment for this, and put somebody on it and send them on their way.
Yeah, Western medicine is really good at treating the masses. You got to remember also that medicine was born on the battlefield. And so it was like, get people stabilized, get them to a healing area, for example, and then the nurses can take over and nurse them back to health. That's where medicine really comes from. It was from injury and damage, mostly from battles. And so it's do as much as we can for the biggest number of people possible. And that's where we get things like evidence-based medicine, and people are always wanting evidence-based, scientifically peer-reviewed studies and stuff like that. But over time, over the past 25 plus years I've been doing this, is I notice that I always get the patients, and it's not just me, but we get patients that come in and say, well, I'm the one that's different. And by golly, they always are. Nobody has just a migraine. Nobody just has simple low back pain. I mean, yes, yeah, okay, 80% of the population does, but there's 20% that are like, how did you show up with this? You know, there's different things that we can have. There's patterns that we should look for. You know, like something simple, low back pain, for example, affects 80% of the population at any given time, sometime in their lifetime. And low back pain has a certain number of things we're looking for clinically. We have neurological tests, orthopedic tests, and basically palpation, which is feeling things. You have tight muscles, etc. And there's subjective, and then there's objective. Subjective are the things that they tell you that I can't. I mean, I don't know if you're in pain. You say like, I'm in pain. Oh yeah, how much? 5 out of 5 out of 40. What? And so people have different pain scales for themselves, even though we have what's called the visual analog pain scale, which you've probably seen has little pictures of the smiley face with like, I'm really happy at 0, no pain, and then all the way really crying at 10. And they have to point to where they're at. And they say, well, I guess I'm a 4, but your 4 might be my 7 or vice versa. You know what I mean? And so trying to tease that information out from each person, I don't know, that's where I get in. Because I mean, I go to the doctor too when I have a problem, and it's always I get the basics. I'm like, okay, you come in, you're going to get an anti-inflammatory, and you're going to get a nasal decongestant. I'm like, okay, well, I could have bought that at the pharmacy, but now I'm getting the high end stuff. Let me get a steroid anti-inflammatory, and let me get a heavier decongestant. This is prescription only. So then, if that doesn't work, then we have to ramp up to the next level. So like in, say, back pain again, if we go like, well, let's try some non-steroidal anti-inflammatories, do some stretches and rest, blah, blah, blah. That's what they always used to say. And then they say, well, that doesn't work. Let's do 6 weeks worth of physical therapy, because that's what most people need. And usually it will resolve within 6 to 8 weeks. And there you go. You got 80% of your people, you're successful. But what do you do with that 20%? Or even 10%? I mean, that's a lot of people. And with those, we have to go like, okay, so if PT didn't work, so now we have to do, okay, let's do injections, because that's extra. Let's do steroid injections or renokeratotomy or whatever it is, some kind of thing that they're doing nowadays. And if that doesn't work, then we do surgery. And they always think the surgery is the end result. Surgery is something like a chance to cut's a chance to cure. In most cases, I love surgery because if I have a stick sticking through my neck, I want a surgeon to pull it out, not anybody else. But at the same time, these days anyway, and in the Western American medical model, it's about going through that process of try this first, come back for a review. That costs money. Try that second, come back for a review. Let's do some other studies, which costs extra money. And I'm like, me being a cheap guy, I'm like, how do I do this or help people do this without going through all of the steps? Because I got people come in, they want to have there's a hint. Like, something's not right with your back, man. Something's not right. This numbness, nah. How about an MRI? Well, my medical doctor said I have to go to an orthopedic surgeon first to get a consult. Then they'll do x-rays. Then they'll have another consult. Then they'll do an MRI. Then they'll have a consult. And then we'll see what we're going to do. Have you ever tried to get an appointment with these people? It could take 7 months. You're dead or better by then. And so I'm trying to how can we do that ourselves and reduce the problem and get as much information? Good questions. Good questions is all I want people to have. So if I send someone for an MRI or a blood test or something, which I can, now I found places that you can get blood tests on your own, the one you want, and they send you the information. Or I can send you for an MRI. You pay cash. It's out of insurance, but it's super cheap and worth it. And then you can walk in and say, here's my CD, or here's my blood test. What do you think? You cut out 4 more steps, and that improves your healing time and your compliance and reduces your stress. So then you end up like, hopefully, out of that average and norm, because I mean, I it's not possible that I have, say, 100 patients and 85 of them are outside of the norm, right?
Mm-hmm.
I mean, it would make more sense that I had exactly 20% of them out of the norm, which would be the norm, and 80% of them, they get better within a few weeks, but that doesn't always happen. They come in, their patterns are different. Their way of presenting there's something not right. And if you have good diagnostic skills and you're looking really holistically, which is also a kind of an issue these days in Western medicine, they don't do that as much. You go to very specialists of specialists, and they know an awful lot about a very, very small piece, which is really good, because if I figure this is a kidney issue, I want you to go to the guy who only knows about kidneys. But how do you get there? Do you want to do 40 steps or 3? You know what I mean? That's kind of where we try to approach it anyway.
So from your aspect, when somebody comes in and they have your lower back problem or like the stress on the shoulders type thing, how long do you start? I mean, how do you go to figuring out whether it's stress related or an issue or something else?
It takes some rapport. And this is another thing that I see that is kind of, I don't want to say missing, but because the way medicine is, I teach at a college, and I teach respiratory therapists, nurse practitioners, or not nurse practitioners, registered nurses. I teach them all the anatomy and physiology stuff. And we always try to go in through some of the clinical things. And one of the things I've noticed is that they're never taught bedside manner, right? How to approach a patient. And it's really funny. Like in the cultural, I had a whole section I had to do on culture. And it was like, this is really weird, man. I mean, my girlfriend's black. I'm obviously white. And one of the things it says in there is that you shouldn't look black people in the eye, because I could be considered aggressive or a challenge. I'm like, what the heck are you talking about? And like certain people, you shouldn't touch them on the head, or you should only have, you should only speak to the man in those things. Those are cultural issues. And if we don't, at least one, you have to start to know people. You have to like people. One of my teachers always said, you should love money and it's love. I got it messed up already. Love people and use money, not the other way around, right? And it's the part of like getting to know people. As Masha knows, I'm very chatty, and so if you come to my office and you say I want the half-hour treatment, that's even long. I mean, it should take me 10 minutes to do my therapy, my evaluation, my therapy, and the adjustment on someone. Done. Never happens, because I want to know what's going on with your kids, what's going on with your life, how's your day been, how's your week been, how's things going. Any interesting things you're going to be doing? Any adventures coming up? And then I get so much more information. They say, well, my family this, my cousin that, my daughter this, whatever it is. And that can tune me into like, oh, okay, so this isn't just because you were stacking wood. This is because you've been stressing out because your kid's been leaving in the middle of the night and you don't know what to do with it.
Yeah.
We had had a man who came in and he was getting massages. Back when I had massage therapy, and he came in and his blood pressure was high. He's like, I'm taking all these meds and stuff like this. And I'm like, wow. So this, I was chatting with him while they were setting up his room. And it turns out his daughter was like taking off in the middle of the night. She was going to the clubs, and she was dressing all skimpy and stuff like that, and going out with some bad kid, blah, blah, blah. Typical story. And so his stress level was like really high. He was like, oh my God, I'm the worst parent ever. She's going to be living under a bridge and on drugs and all this kind of stuff. That's his mindset, right? So he's freaking out. His blood pressure is going through the roof. And so he gets on meds, and eventually, I can't remember what happened. I think the daughter broke up with the guy or something like that, or all of a sudden became like a little scholastic kid, which freaked him out for a little while, because he's like, well, okay, now what's going on? You're messing with me. And she became this like perfect little kid, because they had a good conversation. They had good interaction with each other, and good communication, and his blood pressure dropped. but he kept on his meds because he was told he has to take them the rest of his life. And his heart started missing beats and he'd get faint and stuff. And they said, oh my gosh, well, that's because you have a heart problem and you need to have a pacemaker. And he came in and he's like, yeah, I'm going to go get tested and fitted for a pacemaker. I'm like, well, aren't you still on blood pressure meds? But your blood pressure is like low. If you stop taking blood pressure meds, could it be that it goes back to normal? He said, well, I don't know. I'll ask my doctor. I said, yeah, ask your doctor because I can't tell you yes or no. He went and asked his doctor. The doctor said, no. You have to take these forever. You can't go off these. So he got mad, stopped taking them, and his blood pressure went to perfect, 120/80, within a few weeks. He stopped taking his meds, goes back to his doctor. He says, well, good thing that the blood pressure meds are working because your blood pressure is better. He's like, well, I stopped like a month ago or whatever it was. And so he gets in all kinds of trouble. Thank God he didn't mention my name, but I mean, usually you get like a bunch of eye rolls that the chiropractor said this. But it was one of those things we weren't thinking and weren't getting to know his world, and just taking him off the street. Symptoms that you have, whatever they are, upper back pain or shoulder pain or whatever, headaches or digestive issues, is a snapshot. So it's like going outside my office and taking a camera, like take my phone and go take a picture outside and come back and show you and say, all the cars out there are this many red cars and this many white cars and this many blue cars. And that's the way it is. But in half an hour, it's totally different. There's nobody out there. And that's what it's more dynamic. And that's where that's the hard part of this work is you have a relationship. And then so you get to know people. And they'll text or email me and like, what do I do about this? And, me being the geekoid I am, if you send me other information from another doctor, I'm going to look it up and I'll tell you. And I'll interpret that for you because I want people, like, the idea is to know what questions to ask, because the answers are all on the Google. We can look everything up, not well all the time, but you have to know how to ask. And that was one of the, I think, biggest things for people is know how to ask the right questions at the right time by getting the right information. And so there's a lot to do. That's a personal thing.
It's a personal thing, but I don't think the medical side of things lets you have that personal relationship anymore. So that makes it difficult. I mean, 20, 30 years ago, the family doctor would have been doing the same thing, but you don't get that today. So that's a big difference. Go ahead, Masha.
We used to call our family doctor. I remember. You'd call him at home. Go call Dr. Broden. Yeah, or they would come over. Exactly. That's back in the day. And I remember my father calling him and saying, like, hey, what do I do? And he's like, all right, do this, and then I'll see you on Tuesday. Take 2 aspirin and call me in the morning. It was one of those kind of things. But nowadays, these poor guys and women, whatever, these poor providers are just slammed. You're going to pay a guy $200,000 a year. You better be making about $5 million off him, right, to make it usable. And then all of the administrative costs and all of the other billing costs and all the other stuff. So are you going to be able to spend 20 minutes with a patient? No.
Oh, no. They prescribe, while you said they barely even put your hands on it. And, once I've survived my medical crisis, and Western medicine actually is part of the problem why I ended up where I did. So gratefully to people like you and family doctors who actually look outside the box and ask the right questions and look at you holistically and say, okay, well, this does not make sense. You're too young to have this particular issue. And I don't believe you're an anomaly. Let's look a little deeper, which leads me to a question, Dr. Sean. What are the top 3 complaints patients come to see you today?
Top 3? And that's weird because those... Okay, if we go as general as possible, it's the main thing I get is musculoskeletal complaints. And then as we dig, we'll find other things, but it's mostly like, oh, my low back or my upper back or my shoulder or my elbow or what have you. And then for some reason, I will get a bum rush of everybody for 2 weeks has the same shoulder problem. And it's really weird. I don't understand how that happens. But the main thing for me is musculoskeletal. The second thing I'd say after that would be either digestive issues and like vitality issues. People feel ill, but there's nothing wrong. There's nothing organically wrong. They don't have a bug. And then the third thing, this is weird, is fertility. I get a lot of people in here for fertility, for acupuncture. And that's both ends of it too. It's like when they're trying to have a kid, which we're trying to get both the male and female, and that's a whole crazy discussion you can get into, because there's an entire industry built along how that doesn't work, and then how to make it work is complex but simple. It's really weird. And then on the other side is when they're about to have the kid, and then after they have the kid, we want to support both physically, emotionally, and chemically, with those things. And usually we're doing chemically, we're doing with nutrition, or supplements, whatever. Because I don't prescribe, medicines and stuff like that. But, we try to okay, well, how about this? Try this and this and this. And then, I get a lot of people with new kids, and it's like no one ever tells anybody anything anymore. You don't learn from grandma, but one, because grandma's not around. You live 800 miles away from the rest of the family. And so you can talk on the phone and bounce the baby around, and, oh, look, they're getting colicky, so do this. And, and that's it, whatever. But, it's like in the old days, and I'm talking 30 years ago, like you were saying, it was like auntie, nana, grandpa, whoever, somebody was like, oh, I remember when you had this, we did this. And there you have oh, okay, so that'll work. So don't freak out, right? When the baby does this thing, don't lose your mind and go emergency. But now we're trained to go straight to the emergency room, or go straight to those things. And we've kind of lost that ability to, self-treat, I guess. I don't know. Yeah.
And we rely more heavily on outside forces, thinking that they're there to help. And I think the intention behind that is there to serve and to serve good. But I think a lot of things are misinterpreted and not put in the right places. Like something that you said earlier is, I carry my stress in my shoulders, right? So something that you said, do you believe that we carry emotional trauma in our muscles? And does that explain why we have knots?
Yeah, there's a whole, I don't know what you guys know about chiropractic, but chiropractic is very weird, and it weird in a cool way. In that for a long time, and a lot of it was stolen from acupuncture theory. So acupuncture goes back by 6,000, 7,000, 8,000 years, depending on how you're looking at it. And a lot of the things they would say, oh, he has red eyes, that means too much liver fire because they're angry, because of anger. Anger stresses the liver. Grief stresses the lungs. Fear stresses the adrenals, the kidneys. And then worry affects the stomach. Now we can all relate to that, because people say, don't worry, you're going to give yourself an ulcer, right? Or don't get so upset all the time. You're going to give yourself high blood pressure. You're going to give yourself a heart attack, right? It's the same thing. And so we can see these over-emotionality can give you heart problems. And with that, they call it frightful joy, which doesn't make any sense to me. But way over the top emotion can give you actually heart issues. And if you don't express it, it can settle in those tissues. Many times we would say the issues are in the tissues. Now, if you look at the acupuncture meridians, right? There's a meridian for large intestine, goes from the thumb here all the way up, right up into the head, whatever. And that's my little dog, Maggie. So that one can cause shoulder problems, right? Or arm problems, or people with arm problems. We have to look at those, and it gets even more bizarre, because I'd have patients come in. I remember this a long, long time ago. We had a guy come in, and he was having really bad back pain, so bad that I was on the second floor. I had stairs. Crazy thing to have a chiropractic office up on the second floor by stairs. I had to give him a piggyback ride up the stairs to get him into the office. And all the orthopedic tests and neurological tests were doing okay, but he was in such bad pain he couldn't even move. And so I sat there and put him on therapy, and I'm sitting there talking with him because he was the last guy of the day. And he tells me this whole story about how his entire life has come apart, and he moved out from Kansas to Los Angeles to get in the movie system and become an actor, or whatever the heck it was. And his girlfriend kicked him out, so he had nowhere to live, and he was all by himself. And so all of these really foundational issues, not having a home, not having a job, not having income, which is your lowest in the Maslow's hierarchy of needs, if you remember that one, your basics, was missing. And that relates to your sacrum and your lower back. And so his lower back was out. And when he finally got a new job, had a job interview, his back cleared up super quick. There was other things too. He ended up having to have surgery, but it's a very common thing. We had one lady come in, her right shoulder hurt. So I'm like, okay, so what'd you do? Did you pick something up? Did you drop something? Did you fall? Did you throw some, whatever? I mean, all of the simple things we could think of. Nope. So did you sleep on it wrong? No. Do you do this? No. Do you do that? Whatever. And it turns out she's sitting there laying, we're on the table face down. I've got the pads on her working the muscle stim and stuff. And I'm talking to her and she's like, well, my father's really older and he just had to move into our house. So I'm really having to shoulder the responsibility. And I'm like, really? You're going to say it that way? Shoulder responsibility, huh? And that's what it was. The more she expressed and talked about her father, the rougher it was on her. But that helped her, and I use that as a meditation. I'm like, because you can't say that's the thing. If you have an eye problem, it doesn't really mean, it could. It means you don't want to look at what's going on. You could say that. But, it also could be you have something in your eye. So clean that out first, do all those things. And then you can use that as a meditation. Like for her, it's like, what does it mean to be responsible for your father as for someone who is responsible for you? And now you're having to take care of him. Like you're having to like carry him almost literally and lift him and be the strong back that he was once, kind of thing. And so that can hopefully give some insight to the people and they can, say, okay, so maybe there's some of that in this, let me take care of me too. Because, if you take care of everybody else, then your cup is empty. Your bowl is empty. You have nothing to eat yourself, and you won't last. We have a lot at the hospital I work at.
Dr. Sean, it's really interesting. And that last story about how she literally expressed that burden of carrying on her shoulders. So throughout, my history working in healthcare, like I said, I always worked overtime. I would go into the doctor for, first they thought I had a stomach ulcer and I'd just gotten married. I was working, 45 to 50 hours a week. I was completing my master's degree. We just had a new house. That's a stressful situation. What's interesting is no one asked me about any of that. They just said, oh, you have a stomach ulcer. Here's your Prilosec. Here you go. I could have actually told them I was stressed. I knew it. And I kind of wonder if we don't actually know, and it sounds like you're used to listening to these cues and that perhaps we actually do know what's going on, but maybe we don't want to admit it to ourselves. Do you think some of that is going on? It sounds like, as you talk to people, you're really good at uncovering this.
I think a part of it's a cultural thing, because if we think about, so my family is a large part of my family is from Finland, and they're like the most stoic people ever. Like a whole conversation would be, not even a smile, and you get home and be like, oh, I had such a nice time with so-and-so. And then like my girlfriend would say, well, what'd they say? Nothing. Well, you guys talked, didn't you? Yeah. What'd you talk about? Well, I don't know. And so we don't open up. And see, Russian too, huh? Similar.
Oh no, we can shut up. Our problem is we can't shut up.
we can attest to that. Sometimes we're like, Russia, I know.
And the thing, I think we're kind of trained also because having stress is a weakness.
Yes.
You can have an ulcer. Ulcer, yay you. Go get some Prilosec. Ask for the little purple pill. I think is purple, whatever. Ask for that pill, and then you go there and you get that, and then you're better. And no one asks how you doing. Say, how's it going? Oh, I'm okay. Okay, good.
Yeah.
Right. I mean, that's the whole. Oh, sorry. Go ahead.
I think that we also come to a point where we don't want to admit, even though we start recognize we're in stress, because then that's one more thing that we have to solve.
Yeah. No. Oh man. A+ on that one for sure. I really think that's true. Because there's times when things are going mess up, and then as you avoid this and you avoid that, you get that procrastination cycle, man. And then pretty soon you're not doing the things you should be doing, and then you don't do the things you have to do. And pretty soon you're so far behind, and that's stressful. So it's so wrapped up in itself. And then to ask someone else for help, That's another thing. Mostly these days, a lot of people, you see it online now about like men don't say things about their mental health. Well, yeah, because part of it is you have to be used to be around other guys and get ridiculed and get hacked on, and trolled like crazy with your friends. And then you have a thicker skin. But these days, nobody does that because that's considered so aggressive or something. And so we don't have the mechanism. You know what gallows humor is, right? So gallows humor is like I was a medic for 10 years in Los Angeles, and crazy bad stuff would happen, and a lot of trauma, and there was times I'd come away from things shaking, but we would joke about it, and that would diminish the trouble somehow, and then you'd giggle about the most inappropriate. Oh my God, it's terrible. It's really terrible how that gallows humor can be. And if you're on the outside, it looks really bad. But on the inside, when you're in it, it's like that's the thing that helps you. But there again, we're having a problem with that these days. You can't express yourself, effectively because, what if you say something that's misogynistic, or you say something that's racist, or you say something that's whatever. Pick the ist, right? Ageist, or whatever it is, culturalist. These are things like comedy used to be that way. It's not that way anymore. You get canceled or whatever it's called. You get canceled and you get in trouble. I have to be very careful. I work with at the hospital, the psychiatric hospital. We have a group called the Heroes, and it's all active duty military, police, fire, those guys and women that are going through whatever, and they're put in this one ward, and so they really want to express themselves, but they know that they can't.
Well, and the interesting thing is, I think social media has made it so that you don't have those close connections anymore as much. So then you can't build a relationship between the same sex and have those conversations to help work it out as easily as what you could have when like we were in our 20s.
Yeah, and I think that is actually somewhat stressful too, because when you don't have any way to really effectively deal with your stress, because you can't tell the person, hey, I disagree. You can't walk away. This happens at work, obviously, a lot. Sometimes there's not a good outlet for dealing with that stress, which is why we come to see you, Dr. Sean. We need somebody to help us with it.
Yeah, one of the things I notice, we'll get it going. Watch this. Water's always good.
Take your time.
One of the things I've noticed, because I work one of the other wards there, is kids like 12 to 17. And then even at the high school that I teach at, well, one things I notice is they have no physical release of energy. Like I remember having, at least up into middle school, we had recesses. And they say, get outside and go run around. At my house, when I was a kid, it was like, get out of the house. We don't want you back till dinner time.
Yeah, I was going to say, it's not just school. Your mom used to kick you out.
Oh, all the time.
Right? I don't want to see you till it's dark.
Exactly. Yeah. When the street lights come on, you better be home. That's it. And for my father was he was like, get out of here. Don't come back until I whistle. But you better be back by the third whistle. And so you had to stay within earshot. It's the thing. But, those kids get none of that now. Like the school I teach at is Colorado, it's early colleges. So they have some college level, not college level, but you get college credit for some of the classes. And there's no football team, no basketball team, no gymnastics team, no wrestling team, no ski team, no cross country team. There's no, pick a sport. There's none, nothing. And so they're sitting there stewing in their own juices and hormones and all that activity of a young person and can't express it. So it comes out in either it's internalized distress, or it comes out in other non-productive ways. They're online all the time doing something stupid. And so they need to get out and you're like little kids. What do you do? You send them somewhere, they get tuckered out, you're happy, they go to sleep. We don't do that anymore.
Dr. Sean, you said something really interesting about internalizing stress. I think we talked some good examples about physical stresses and some examples of how we carry stress and what kind of injuries it could portray physically. But what leads to that? You mentioned earlier there is chemical response, there's also mental response, and then there's physical response. So in my mind, before it becomes physical, we still have a Grand Canyon of things that's happening, whether you understand it or don't. So can you talk to us a little bit about what's happening within our bodies that we are not aware of when we do trigger that stress response?
Well, that's actually, I think, the hardest thing. I actually so that there's some predisposed things that you may have. So for example, I've had back pain, back problems since I was a kid, 19 actually. And it comes and shows up every once in a while. Many times if I'm stressed out, it weakens me, and then I end up doing something stupid and then messing my back up and I'm out for 2 or 3 days. This past a couple weeks ago? About 3 weeks ago, I was just doing something very dramatic and crazy. I was cleaning the shower, reached down for the soap, and my back went out and ended up having to sit the rest of the time on the floor. Now, so where did that come from? One, there's a weakness. Two, I was probably overworking, doing all the crazy projects that I'm doing and wasn't resting properly and just happened to hit it just right. Same thing with, it's kind of like that, the what's that story? The straw that broke the camel's back. You don't know which one it is. It's just all of a sudden, bonk, there it goes. And same thing, like once that cleared up, I ended up with this whole bronchitis thing. Now, was that because, one, I was around a bunch of kids during the beginning of school? That makes sense. Or at the hospital, there was a lot of sick people. That makes sense. So my immune system was down because I was fighting off this low back problem, and not getting rest because you can't sleep when your back hurts, right? So I'm like trying to sleep on the floor and in weird positions and all this jazz. So it kind of depends. And sometimes it just shows up out of nowhere. There's like people ask me all the time, my shoulder hurts or whatever. How did this happen? I'm like, I don't know. I haven't had your shoulder the whole time. You did, but then again, even though you know exactly where you've been and what you've done, there may not be the answer, if that makes sense. I mean, that's part of that stupid riddle, where you're like, okay, so how did it start? Where did it come from? We'd like to find that, and it'd be great, like, oh, I was outside throwing the ball with somebody, and I heard a pop in my shoulder, and then it tightened up. Perfect. Gotcha. It's a strain, a little bit of sprain injury. We do this, this, and this, done. But what about the person who's like, all I do, I just work. Came home, fed the dog, ate, sat down at the TV, was going to watch a little bit of TV, reached over for the remote, my neck went out. Where'd that come from?
So one of my favorite things that you say is, so you're burning the candle at both ends and in the center. And it always gets me thinking, true. So would you say that some of the symptoms, early on symptoms before a crisis, before your shoulder goes out or your back goes out or, something else that could physically happen to you, would you say that we have some clues like we can't sleep? Why can't we sleep? And the next day we overcope, unhealthy coping mechanism, right? That extra cup of coffee that we really love. And before we know, we have thirds and fourths and etc. And then we can't sleep more. So in your opinion, what are the early things to look for if we are stuck in the chaotic day-to-day life that we just have to respond to things and show up on time, and we don't have that space and time to get rest that we need?
First thing, if my girlfriend sees this, she's going to smack me, because that's one thing she says all the time. How come you're not resting? You don't rest. And when I rest, I don't rest. I go home, I stay home all day, but I'm working on this project, that project, got the yard to do. I'm gonna cook something big, and then I'm gonna take apart this thing and whatever it is, so I don't actually rest. And I know it. And one of the other things I do is I go like, I think it's a laziness I have, and I think everybody has it too. But I go like, you know what? I should drink more water. Well, water's right there. I could stand up and walk over there and get some water like in 20 seconds. But I don't. Because I don't know why. So I think part of it is like listening to that like, you know what? I know I should. And so why don't I? You know, like we all know we should be outside walking around more or get more sunlight or whatever it is. But we don't, not because we don't have time, because we don't make the time. You know, there's still 24 hours in a day for every one of us. You know, I remember when I played bagpipes for a long time, and I was complaining that I didn't have enough time to practice. And one of the guys in the band was like, dude, you have exactly the amount of time we have. You just don't make the time. I'm like, oh, well, yeah, that's true. And so making the time, and that's the hardest part too. And it's like, even with like, so something like meditation, which really you could say just, how about respite? You're going to take a freaking rest. We don't even, we have to power nap. We power sleep. We don't even chew food. You know, we inhale food. And I mean, I was taught that from a kid. I just like eat and get done, you know, go do your thing. As opposed to stopping and really, really appreciating what you're doing and being really mindful of whatever it is you're doing. I mean, you're watching TV, watch TV. Don't watch TV and be on the computer and play these other things. It's hard to do. I mean, I'm just as guilty as everybody else. You know, I mean, it's terrible. I try to go to sleep, but I'm also trying to like think about what I need to do. My brain will do that for me. My brain will like give me 28,000 things to think about. And then if I catch it, I go, okay, you know what? I can't do that now. Let me do some breathing and whatever exercises. Let me do this thing and I can relax. Listen to a guided meditation or something like that. Then I actually relax. That gives me a little bit of like, you know, as that needle's going up towards the red, you know, as soon as I actually relax, it starts to go down. And then me, I'm like, I start running as soon as it starts going down again, and I'm constantly bringing it to the red.
So Dr. Sean, would you so you're saying your gauges operate on the red, but you're good at recognizing it, so that's good. So do you
and
think
that's I think the first thing to do. If you can recognize that you're getting into the orange or the red or whatever, and as soon as you can start seeing like, whoa, I'm getting a little too much, then the second part after realizing it is knowing what you can do, right? And then actually doing it is the third part. Because when my back went out, the first thing I did was complain and gripe and piss and moan and lay around on the floor. And then I realized, well, wait a minute, I'm a chiropractor. I actually have all the therapy stuff at home. I can do this. So then I actually, okay, so do I want to get up and go downstairs and start treating this? Or I'll stretch. Okay, maybe I'll do it later. No, as soon as I start doing the things, that's when things turned around. So you're right. It is totally like being able to recognize first, then understanding, like you recognize and understand what the problem is, and then understanding what the actual, can you do anything with it? And then what do? You know what I mean? And then do the thing you're supposed to do.
So, Dr. Sean, people who are extremely stressed, like they are to the burnout point, often they don't know what to do. They don't know what they can do because they're just trying to survive. What would you say to someone who comes in, let's say they come in to see you and you pretty quickly figure out, this person is just completely in burnout. They're so stressed. Like, where do you start with someone who probably, they may or may not recognize it, they don't know what to do, they don't know what they can do?
I think the first thing is the realization, do we have to come to the realization, they came in, so they said, something's not right. Something's wrong. I am suffering. I have this suffering. First step. Ding, ding, ding. Now we have to do, what's the cause of the suffering? What's the cause of that problem? And if we can determine that, or at least like, what are the contributing factors of this? And then, can we do anything about those? Which ones can we do easily? How about this? Why don't you start taking these supplements? It's a very simple thing to do. Like, so, I say simple, but I have bottles and bottles of stuff at the house that probably is going, bad that I don't take. I should, but I mean, at least it's there, right? And if I'm mindful and I do take those things, then I can say, okay, now I need to do these other things. So the recognition, and if we show people that, like, okay, you definitely got something going on, right? You realize it. I'm stressed. So what do? Well, the first thing is I go home and I'm going to eat, because it eats comfort. That's good. But what are you eating, right? Maybe we can play with that first. How about you add, I don't know, more vegetables or something? There's something we can do. So it's tiny little steps, and to give people hope. Like, okay, something can be done, and as many options as possible. Like if you're, like you say, like, where do you start? At least you know something's going on. That's a good start. Now what? Now we start, like a lot of people, they just get on Google. They go on WebMD. I have this. Oh my God, I'm going to die. Oh my God, I have emotion cancer. Oh my gosh. And then you read all these stupid other things. And that's where asking the right questions. And then maybe coming to someone, or going to, like, because you have, like, that experience too. You've seen these things. And they could go to either a friend or, like, to you, and you can say, like, well, it sounds like you're kind of, like I would say too, you're burning the candle at both ends, you're melting it in the middle. At some point it's going to fail. And, like, I remember my dad would always say, you can only juggle so many balls at once, right? Everybody's always trying to spin plates or juggle balls. Whatever. Juggling balls, sometimes you just got to let go. And you let them fall. And sometimes that's my advice, is let it fall, and the important stuff will end up right at your feet. And that which is not important will roll away. And it'll be way off in the distance. But once you get good again, you can decide, well, you know what? I don't even like doing that one. I'll just do these ones that are close to me. And I can do it one hand. I can do it one hand. I can do it when I'm sleeping. Whatever. Now you can juggle easy. There's not a point that we can say you need to take a full break of everything. Good luck. You need to, retire and don't pay any bills and don't get any bills and don't do taxes and don't eat bad foods. Who can do this? No.
And Dr. Sean, we did decide to sell everything. We bought an RV, we took a sabbatical, but you are correct. You still have an awful lot of things you got to do. It's not like you ever get away from it all. You can't just drop everything. Just just living means you've got to deal with stuff.
But see how you guys did it, though. You guys had a strategy, and your tactic stuff was to get out. Literally getting away.
But
which, I mean, I love that.
Anytime you leave, everything comes with you that you haven't dealt with. So you still have to deal with it.
That's true too. That's very true.
Yeah, I had to bring him with me. I'm just kidding.
She won't drive this thing, so she has no choice. She's
That's
stuck.
true.
But I mean, that's the thing. So, but also what you guys did, though, look at that. It's just like letting go of those balls that were up in the air. You got rid of so many things, right?
Yes.
Now you have a house that can go where it needs to go, or whatever. Of course, there's 84,000 other things you got to deal with. I mean, nobody had to worry about their wheels on their house, or the transmission, or did someone change the oil, or something, or emptying the sewer, or whatever that stuff.
Yeah.
That's a different thing.
There are definitely nuances that are similar to owning a house that people who full-time RV have to deal with, but there's also a lot of simplification.
Yeah, and I think that's what it sounds like. What you guys was.
One thing you said earlier, which I liked, was when you let the balls drop, then you pick up the balls that you enjoy. And that to me was really interesting, because that's what we did. Because yes, there's still balls that we have to deal with, but the thing is, we love to travel. We love to go see all these things. I love to walk the miles a day, which I do with my dogs. So we did pick up the balls that we loved, and I guess that's really interesting that you said that way.
Well, and it is an extreme option to take, and not everybody can take it. Or should. Yes. So we can't say this is the best way to solve your burnout is go take a year sabbatical and drive around the country. Because you got to really like doing this. You got to like living in a very small space with your partner, and you got to be willing to work through your junk that you're carrying around with you. So,
and one of the things that Masha said earlier on too was to simplify, and really that's what you guys kind of did. And you're also, that which you love is worth the price. I mean, I'm not willing to jump up on the roof and do all this stuff, but if I had an RV, I'd be like, hell yeah, give me the ladder. I'm going up. It's fun. Because as soon as we did this, we're on the road.
I think that's a different. I think it all comes down to a conclusion that I've been kind of drawing myself over the last year, is that we become addicted to our lifestyles. We want, we accumulate, we hoard, we keep, and then the lifestyle owns us. So we're become, I don't want to say, we become consumed and possessed, and our possessions possess us versus us possessing and using our possessions. We come to the point where when's enough is enough, right? And then coming to realization, I don't need everything that I have. So how do I simplify to the place of peace, that I'm not overburdened by things owning me, because I have to now pay for things that I've accumulated, maintain them, right, in some shape or form. And looking at the leap Michelle and Brian has made, it's really exciting. It's like I'm craving this simplicity, because of simplicity, you kind of shed the stress of everything that owns you, that you have to respond to in some shape or form. What are your thoughts about that, Brian?
Well, I want to interject here first, because the simplicity lasts for a while. But after you get done with the simplicity and you start working things out, you start wanting to get complicated again. So, my mother-in-law, when we were doing this, we asked, well, who do you think's going to quit RVing first? And she's like, it's going to be Brian. He likes his stuff too much. So we've simplified, and we don't have a lot of stuff anymore, but as we start working on this rekindle and adventure, and we start getting more active and stuff, you start to have things that you want to be able to do and expand out and everything else. So I think being simplistic is good for a while, and if you can do it for a long while, then great. But it's going to start coming back, and then you have to reevaluate, how simplistic do I want to be?
So, question for you: did this leap improve your quality of life and your health the last 2 years?
Yes.
It's improved the quality of life. It has somewhat improved my health, but on the other side of it, Michelle did a lot of walking and stuff to help her health. I sat in place and just dealt with my emotions and my mental state for too long, to where I've lost muscle. So it's kind of both.
Yeah. And I did have a different experience, because we have 2 dogs, and I prefer to walk them. I don't know if they prefer it, but I prefer to walk them for miles every day. And so when I'm out there, number one, it's good for meditation, because, it kind of keeps you in the present as you're out there in nature walking. But I've been able to reduce the medication I was taking for acid by half. I used to have these neck and shoulder issues where my whole arms would go numb. I mean, this happened for years and years. And again, nobody asked me about stress. That's pretty much completely gone away. I mean, I didn't even realize it till we were having this conversation. I'm like, I can't actually remember the last time that I had that. So, yes.
Well, I mean, look at how many dishes and stuff you used to have. If you guys in an RV used to have all the pots and pans and 14 plates and 23 bowls and 62 forks and 47 knives and all this kind of stuff, now you've reduced those things you don't really need. Like, you have the stuff that you need, and that reduces the amount of real estate in your mind it needs to take.
And that
And
is
that's
true.
not just there. I mean, think about all the closets you had back at home, or whatever it was.
Well, and yeah, you
The
don't
ones I
have as
didn't even
many.
know what was in them.
You don't have as many clothes because you can't carry as many clothes. So then that becomes more simplistic. So then you realize that you don't have to, dress to the nines to go out to have dinner. T-shirt and a pants or a nice shirt occasionally works. And you just start, you have to live simpler when you're in that type of situation. I won't disagree. And
Yeah.
it does clean things up.
Well, remember, I mean, go back to the 1800s, early 1900s. If you wanted to go on a big trip, you had to bring a steamer trunk. And the steamer trunk had everything that you would need. And then someone would want to bring the good china and the crockery and the tea set and the other nonsense, like you're going on a safari. Right? But nowadays, you can go somewhere, and you guys also know that most places you go, you can find a store. You haven't been to the moon yet, but I mean, you go to places and you find a store, you're like, you know what, I let me buy some different shoes. Right now you have the option.
Right.
Or not. You say, I don't need that stuff. And I think that's a lot of freedom you guys have in that case. Like there's a movie called The Fight Club, if you've heard of it. And one of the Masha totally just quoted the whole thing. He said one of the things that guy Tyler Durden tells himself basically is he says the things that you own eventually start to own you, and so get rid of it all because it's all junk. It's not going to be there anyway. What's important to you?
I love what you earlier said, the real estate in our minds. And when I think about, I've been meditating on that for quite some time. I mean, we have, when we think about real estate, we think about, physical place that we live or want to buy or physically occupy, right? That's a physical real estate space. But we also have our mental real estate. And our mental real estate, I like to imagine it as, you have this penthouse. It's a very small penthouse, but it's a very beautiful penthouse. What are you going to stuff it with? Are you going to stuff it with junk, with all the things you don't need? And when you think about connecting that real estate to your mind, well, what is in your mind? Do you control your mind or does your mind control you? And if you become overwhelmed and you hoard anger or fear or any other emotional baggage that we tend to hold on to, resentment, right? It's all invisible ownership over our peace. And when I think about my real estate and the peace of mind and equipping myself to have a very intentional day where I'm going to manage stress, it's not going to manage me. I'm not going to react to things. I'm going to be intentional about how I respond to stressors that come in. If I can avoid them, I'll avoid them. If I can't, there is a way to utilize my mental real estate to carry forward.
No, that was good. One of the things that you pointed to was that locus of control, and how you're trying to have control over at least what's going on in your penthouse, right? At least what's up there. And one of the things that reminds me of one of the things that someone spent a whole day with the Dalai Lama, and they woke up, they got there when he woke up, and they would show him and they would go through the whole process. And they're like, well, what do you do when you wake up? And so the first thing he does is he lays there and he already knows his schedule is jam packed. He's going to be meeting this person, doing that thing and talk about this, blah, 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 blah. It's like this stuff here. It's like, it's all distraction. But he has the choice first thing in the morning to sit and go like, how am I going to approach this? Not what am I going to do, but how am I going to approach this? And he tries to foster in himself, like, okay, am I going to be, push, 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 go, go, go? Or am I going to show up with this like calmness and kindness? Or am I going to be compassionate or whatever it is? I mean, you have that decision. And I've tried it. It works if I remember to do it. So maybe I got to post it on the ceiling when I wake up, look up and see that. What's your intent? Intention is so important. What was your guys' intention to get in an RV and go? What was the actual intention? If you're like, well, yeah, that was what it was. Well, but damn, but it's working. Do we have less stuff? Yes. Do we have less trouble? Yes. You know, of course, other troubles, so what? Who doesn't? But I mean, there's always going to be something, you know? And you're like, oh, we don't have enough forks or whatever. You know, but it's like these things, like you said, with your little penthouse that you want to keep nice, you get to choose what goes in. You know, I mean, stuff we do collect. And many times we drag it around with ourselves. But I mean, you know, like some of it, and it's really hard to let go of stuff too. As you guys know, I mean, how hard was it to go through and decide which stuff you're going to keep because you only have that much space to put it in? You know,
The closer we got to selling the house.
really,
Because you didn't have
that's
any,
awesome,
you had no choice.
right? Well,
You,
you still did have a choice. I mean, you could have said, well, you know what? We'll get a trailer, and it'll just be our storage trailer, and we'll tow it behind the RV. Keep all our crap there, where I'll never see it again. You know what I mean?
Storage trailer.
Right.
Wait.
The one thing I will say is that it did get easier the more you practiced it. So early
Yes.
on, after we signed the contract and we knew we were going to close and we had to do it, at first it was hard to make the decisions. But after we started to do it and started to get rid of stuff and simplify, it actually felt really good. In fact, I actually enjoyed giving all this stuff to our sister-in-law and saying, take it to the ARC, take it to Goodwill. Somebody can use this. I don't need it. And it got a lot easier as we went.
I like that. And so now it's a simple thing for you. You know, you can let go of so many things so easy because you did it. You know what it's like. And so if you can somehow push that over into other things in the world, in your life, in your mind, and your stress, that's a really good practice. You know, I mean, some people can't let go of anything. You see the TV show Hoarders. You know, there's the whole thing where they keep everything. As you can see here, these are all books. But I have a whole bunch of crap. I mean, and this is pared down. You know, I have probably this many books at home too. You know, but
Well, and this is true. The interesting thing is the longer you live simplistic, because even though we got rid of probably 75 to 80% of our stuff, we still have the cargo trailers placed at, the family farm where I grew up. And we're getting to the point of, should we just go through that stuff and start getting rid of it?
ooh,
Because you realize the longer you're away from that stuff, the less it impacts you, the less you care about it. So,
Well, and going back to the whole, the space in your mind, it is interesting because once you start to shift your mind and your mindset is changing, it does become easier. So any of these healthy practices as well become a little easier once you have kind of made that mind shift and started walking that road. But I think it's hard to start. It's always hard for us to start, right?
yes.
Yeah, I
although
think
you guys did
another
it,
thing
it's impressive.
about the mental real estate, if you don't control your mind will control you. But if you run out of things you can hold on into your head, I'm a strong believer that our body takes that memory and puts it and shoves it somewhere else. I had a couple of experiences when I could do massage, I can no longer do it. My body is no longer receiving it for whatever reason. So I had to change my self-care, self-responsibility tactics. But when I was able, and there was a knot that was being worked up, right in a very painful area in my back between my shoulder blades. That's where I carry a lot of my stress. And it was being worked out. I had memories come into mind. And I was like, what is that? That is a long memory. Why am I thinking about this? I'm really enjoying this, this therapeutic torture. But then I had this realization like, oh, that was a very stressful memory. It was a very painful period of my life. I wonder if that has been stored in that area that kept me in a very awkward pain cycle for quite some time.
We say the issues are in the tissues. It's very common. I mean, I started 250 years ago. I was doing massage therapy. I was working out before chiropractic. I figured I had to get good at like where everything was in the body. So I started doing massage therapy on people that I knew. And I ended up like expanding from that and doing people that I knew or people that knew people that knew people, whatever. And I remember I was working on this one lady, going there. She's laying on the table. I'm working on her upper back. I found a big old knot. I'm like, ooh, let's get in there and work on this knot. And she starts doing this kind of like moving thing, and she stands up and runs out of the room. Not a stitch of clothes on. So I'm freaked out. She doesn't say anything, just left. And I hear her sobbing in the bathroom. And I'm like, oh my God. Do I leave? Is it over? Is she calling the police? She's got to get a gun? What do I do? Did I do something? Did I say something? So she comes out about 2 minutes later, 5 minutes later, whatever it was, wearing her robe and stuff. She's like, oh, thank you so much. That was so good. I always have these emotional releases. And I'm like, you just gave me a heart attack. And I peed a little. Tell me. I had no idea that could happen. But yeah, you can store patterns in it's a muscle pattern and a neurological pattern. Very common. And when you finally work them out, it shows up. And some people it shows up as anger, some people laughing, some people crying, whatever it is. And you can notice, and then sometimes with a little bit of time and little introspection, that's why I say, like, use it as a meditation. What does it mean? Could mean nothing, but it could be very, very significant. Like you're saying, like, wow, that was a stressful memory. I didn't realize how stressful that stupid memory was. Dang. And that's where I stored it. Back here. I packed it up real good, stuffed it in the closet.
Instead of letting it go and processing it in a healthy coping method, stored it away and carried it on my back, literally, for how many years? And that is one of the references that I have been conditioned with. Oh, you just pack things up and carry it on your back. And I'm like, well, no worry. No wonder I have, issues in that area. And the patterns tend to repeat themselves until you change those patterns and those cycles.
Mm.
So I think it was an excellent conversation. And Dr. Sean, thank you so much for joining us today to talk about all of the little puzzles and nooks and crannies our bodies and our minds connect with stress and burnout. And tell us a little bit more about, if you have some last second tips, what can people do to manage their stress from getting in a place where they're not well, but to have simple things that they can keep on the forefronts of their minds that they can engage with to keep a healthier lifestyle.
Sure. Well, I mean, we get to the point now. So now what? What do we do, right? First thing we did was we talked about just the realization that it's there. Very important step. The second part is the question is there anything I can do about it? And the answer should be, yes or no, whatever. If there's no, then don't worry about it anyway. But generally it's yes. But what? That's where some education takes place. And we have to do some either like talk to somebody else, a provider or ourselves, or journal or whatever trick we can use. Journaling is helpful. Talking with others is helpful. Going on walks with your dogs is spectacular. Sometimes just meditating on your own thoughts. Those are also good as long as you have like an intent with it. And then the next question is like, can that be fixed? As you get to past that question, it's like, okay, now what do I do? And what do we do? So it's going to be like continue to see things early on and try to act on them as soon as possible, skillfully, if we can. And that might mean, find out what our patterns are and see if we can break those patterns or even modify them. I mean, because if you think about it, like a plane flying from here to Hawaii is not on course 99% of the time. They're constantly going back on course. They start off pointing towards Hawaii, but then the wind goes like this, and they have to fly back this way. And then they overcorrect. So it's constantly like that. And that's that process with our own education. And as we get to like try things out, I mean, don't be afraid to try stuff. So you've been trying like, oh, I try massage. What kind of massage? Well, there's a whole bunch of, how many massages can you do? Chiropractic, acupuncture, nutrition, different herbs, spices, whatever it is. Maybe I need to do some kind of journaling. Maybe I need to do some kind of music therapy or singing or art is very therapeutic. Driving for me is one of the most therapeutic things I can do. Actually, one of the I just got a new little car, and it goes like 12 miles an hour, and it's a little tiny putt-putt. But the big old car that I had, I would go out with the dogs and just go on trips. I've been to all four corners of Colorado, and the license plate was going to be, and I'll change it soon, is going to be Cottywomple, which means to travel randomly yet on purpose. And sometimes that's what we have to do. We have to like just go do nothing on purpose. You know, rest on purpose. You know, kind of thing. And I think that, you know, one of the, you know, there's no like, okay, here's step A, step B, step C. You know, it's like, I think it's realize that there's trouble. Yes, good. That's how you solve everything. The second thing is, what tools do I have and what tools may I need? And then after that, you can say like, okay, got some tools. Let me try them out. Some won't work. They don't work on everybody. Like meditation doesn't work on everybody. Like some people cannot do sitting meditation. They can't do breathing meditation. They can't do standing meditation, whatever it is, one of the two. One of them they can't do. And that's okay. Does it mean all hope is lost? No. You know, we got to tweak and find out what we can do. There's something we can do. You know, and the idea is to try to do something or find a support system. You know, like Brian and Michelle have each other. You know, and that's good. If you're a good team, then you can say like, okay, what's going on? Do we need to stop and take a rest? You know, get out and stretch my legs. That's a very small level of stress right there. Now we have to be able to say that. What's the next level? What's the next level? What's the next level? And how do we? You know, what's the big deal with stopping and stretching our legs? You know, getting out and stretching our legs. Going on vacation. You know, did you just bring all your problems with you and on vacation, or are you actually going on vacation? Were you going to stand out on a balcony of a little hotel and go, "Ah, that's a nice place."
Absolutely.
Even though you're looking at the next building, whatever, it doesn't matter. You know, but it's like, are you going to enjoy where you're at now? Because if you do, and not worry about where you're going to be and where you've been, then you're going to be better. Every time you do that, it gets a little better. You know, enjoying where you are. So, I don't know. I mean, the thing to do is to do what you can with what you got. That's about all I mean.
Dr. Sean, thank you for reminding us that our minds and our bodies are one whole. They're connected and they carry burdens and issues among both realms. So it's important to put our mental health as a priority and our physical health as a priority, but do things in moderation. For example, we can drink the water. But if we drink too much water, it's not good for us. It's good for us to stretch our bodies, but if we stretch too much, it's not good for us. As I found out, stretching too much can actually injure you. Little did I know. Dr. Sean, can you please tell our listeners how they can get in touch with you if they are in Parker, Colorado area to see you, or if you can be helpful in an online resource?
Well, I have a website, thenaturalbodyworks.com. People can go on there and you can look at some of the information. I do have a blog that I've done with some of that stuff. I also have I do have a YouTube channel, which has kind of like turned into a school channel, but I have a lot of, you know, stretching and other little health hints and things that I've done. It's The Natural Body Works, actually, on YouTube. And that's really like the best way. I mean, if anybody wants to get a hold of me, they can do that too. thenaturalbodyworks@gmail.com. You can always email me, which will, you know, I'll try and get a hold of those. That's my main work email. So I keep that for those. But, yeah, I mean, just always open for chat. Why not?
Excellent. And we'll also put those links in our description below so you can easily access Dr. Sean and his information and his channels. And again, thank you so much for having this conversation and shining some light on just daily things that could really either make us or break us. You know, why wait until we can't walk to go see a chiropractor? Let's start digging into some changes before we're physically impaired. Well, thank you, and we'll be in touch.